Good evening, doctor.
Good evening. Good evening.
I hope you're doing well.
Yes, thank you. How are you doing?
I'm all good. Thank you so much for asking. Good evening to the audience who will be watching our session. And we have another doctor with us, Dr. Anurag Borade, who will be sharing his insights on the topic understanding different mental illnesses. Doctor, can you please introduce yourself with the audience?
Thank you. Thank you so much. I'm Dr. Anurag Borade. I am a consultant psychiatrist. I have done my MBBS and MD in psychiatry, and I practice in Pune city at multiple places. And I also am interested in creating awareness about mental health.
Right, doctor. Thank you so much. It's really a pleasure for us to have you here. So, can we start with the conversation?
Sure, sure.
Sure. Okay, we'll start some with very basic questions first. So, doctor, what are some of the common misconceptions that you might have encountered about specific mental illnesses, and how can we work to dispel them?
Right. So first of all, we need to understand what mental illness is. It's basically a disorder of the brain, right? Disorder of the brain. What we usually call as mind is basically the brain itself, as per new research studies, and it's basically a disorder of the thought, emotion, and the resultant behavior. So the compilation of all these things together results in a disorder called as mental illness, which disrupts a person's daily life in simple terms. This is what mental illness is. Now, when people think about mental illness, they think that a person who is mentally ill uh, must be a weak person. कि उसको एक तो उसका दिमाग नहीं चलता है, that means उसका intelligence low है, or he is or she is weak, which is not true. Mental illness can affect a highly intelligent person also and a low intelligent person also. It can affect even a strong individual also. So there is nothing to name it as weak, or a low IQ person can only have mental illness. Also, if a person is happy in his life, like, has a good job, has a kid who has good grades, nice financial stability, so that such peoples don't get depression at all. This is a big misconception. ऐसा बिल्कुल नहीं होता है. Anybody can get depression, even when there is stress, even when there is no visible stress. Even then, people can get depression or any mental illness. Another thing is that small kids, adolescents, 12 years and more, don't have any sort of stress. It's a very common misconception. Stress anybody can have, tension सबको आता है. Just that it is, it's such a big thing for kids because they are not able to verbalize it. So it is very more important in kids to look for such signs of stress, because suicide is very common. They say fourth or fifth most common cause of death in adolescents is suicide. So it is very important to look for mental illness in kids. One more important thing is that it is medicines are habit forming. They are bad. They are mostly sleeping pills. It's a big no. There are various sorts of medicines. New age discoveries are coming up. New things are coming up, and medicines are getting created so that a person can get treated with minimal side effects. So it's a big misconception, big myth that medicines are only sleeping pills. Yeah, so far this much.
Thank you so much, doctor, for debunking them for us. So, I'll move ahead with my next question.
Sure.
So, how can social media contribute positively to raising awareness and understanding of various mental disorders?
Okay, thank you for this question, because usually when we talk about social media, we tend to talk about the side effects of
Negative
social
aspect.
media, yeah, negative aspects. So good that social media can surely be used in a productive way. There, everybody knows how to use social media. It's something like बच्चों से लेके like elderly individuals can also use social media. The problem is, uh, it's more like what you should not do on social media, so that you can do something for the awareness of mental health. Number one is, the problem with mental health awareness in India is the somewhat relative inaccessibility to the services, which is solved by social media. Because in social media, on be it a chatting platform or video platform or a social platform. Everywhere information is available. Also, everywhere misinformation is also available. So we must differentiate between the two. How to differentiate whether information is true or not? So many rumors, fake messages come as forwards, and we try to read and try. We get scared about such things. So it is very important to identify the source of the message or a video, whether this source is a forward or the person who is sending to you has written this. Then is the person credible source? Has the person got specific expertise in these aspects, the content that which they are sending or promoting? Have they got any degree in psychology or psychiatry? Are they a social worker in psychiatric field, or are they a psychiatric nurse? These four are pillars of mental health treatment. So identifying the source, identifying the credibility of the source, and verifying it from a credible individual. Also, I would like people to share more of their personal stories, patients or relatives. If they want to keep anonymous stories, they need to share so that other people will be encouraged to come up and take treatment, or come up and identify that yes, such a disease exists. It is very relatable when someone else also shares such a thing. So social media can be used for this also. These are just a few pointers. In a way, social media can be used positively for awareness.
Okay. So, doctor, it happens to us that first, if something has occurred to us, I guess the first line of treatment should be, according to me, is accepting the situation, because sometimes it happens
Yes,
we don't only accept that we are going through something, and then
yes,
reaching out to probably to our friends or relatives could be the other thing that can actually be helpful for
absolutely
us.
right.
So, how can individuals support loved ones going through mental health treatment without, stigmatizing or just not letting them know that, okay, we are there for them? So, how can we do that in a more supportive manner?
Yes, as you rightly said, accepting the illness, because we cannot work towards solving the problem if we deny the existence of the problem. You have to accept it is there. So acceptance meaning doesn't mean that कि है अभी हो गया करके. ऐसे नहीं. What does it mean? What does this illness mean? Gathering that information from the expert, be it anyone, any mental health professional, approach that individual, have a talk with them, take a list of your doubts, ask them those doubts, let them clear those doubts. Then, when you are interacting with that loved one who has mental illness, be available for them. Sometimes lending an ear is itself very helpful. Let them vent out, let them express. When you are listening, make sure that you don't give unwanted advices. If they don't want any advice from you, it's okay. You don't have to lecture them that ऐसा होना चाहिए, ऐसा करो, do this and that. It's okay. Sometimes just being there without any judgment, just sitting there and listening to it is also very helpful. So number two is giving them your time, communicating. Number three is responding to those troubles that they are venting out, responding in a way that yes, this is happening to you, I can understand, and it must be very troublesome for you. Even this much is enough at that particular moment. Number four is to encourage them to lead a normal life. Sometimes what happens, patients who are having chronic mental illnesses have a lot of failures in life. They cannot sometimes work, sometimes they cannot complete their education, sometimes they cannot take care of marital responsibilities of the house. So in such a way, small nudge that yes, you try to do this much work, this will give you some satisfaction, try to do that much work. Also encouraging them to go out in the public without yourself being scared of the eye of the society, that लोग क्या कहेंगे. अगर लोगों के सामने वो नहीं आएंगे तो लोग कुछ ना कुछ कहते रहेंगे. Let this person come out in the open, provided that doesn't trigger this person. Hmm? So let them be out in public, and if they are comfortable with it, right, with the support of the family. And most important is avoid the triggers, as I said. ट्रिगर अवॉइड करना, आइडेंटिफाई द ट्रिगर विच कॉजेस सच प्रॉब्लम्स एंड अवॉइड करना. एंड यस, फॉलो अप करते रहने का with the doctor or a psychologist, anyone. Make sure that you take this person to the doctor every time.
Okay, thank you
Yeah,
so much for such great insights. So, with this, I'll move ahead with my very last question.
sure.
So, have you personally found any alternative therapies or coping mechanisms helpful in managing these mental health conditions?
Yes, as you know, treatment does not involve only medicines. Therapy is also very important. Many a times, therapy alone works. So it depends on case to case basis. As per my personal experiences, if you consider severe mental illnesses, a mental illness which requires medicines, and a person is not able to sit for therapy, तो कभी कभी नहीं होता है प्रोसेस उनको उतना ज्यादा. So in such cases therapy doesn't work, but in mild cases, mild to moderate cases of depression, or any anxiety disorder, lots of therapies available. But in that, most important is journaling, writing your own thoughts down on paper in the language that you can understand. Sometimes you have to write what happened in the day, what things are triggering you, what things made you feel peaceful. Then you can, at the end of the day or at the end of the week, you come to know about those, triggering factors, or which places made you feel really comfortable, which you were not aware before because you didn't think in such a way. So it is a very structured way of, expressing yourself on paper for your own benefit. That is one, I think, is the first step towards, improving. Some people also like to experience relaxation. Sometimes in panic, your head is very stressed, you are not able to feel anything, or you're not able to understand anything, you feel palpitations in your heart, your hands are having tremors, you're not processing anything, you just want to get this stress out of your head. At such times, relaxation techniques help. Relaxation techniques meaning relaxing your internal environment, relaxing your mind, relaxing your heart, your respiratory cycle. So there are multiple deep breathing techniques, boxed breathing techniques. Multiple techniques are available. So relaxation techniques are of, commonly they, I've seen that they help a lot such patients. Then comes, positive affirmations, like saying that you will come out of this to yourself, writing those things, like you have been through this, you will, in the past you have come out of this, so now also you will come out of this. Sometimes taking good examples of others who have also come out of such, phases. So positive affirmation is also useful, but it depends on case to case basis.
Okay, thank you so much. While you were mentioning about the journaling part, I remember that I've heard somewhere that our mind is not usually made up for cluttering. It's meant for decluttering. We are supposed to declutter at the end
Absolutely.
of every day. I don't know how much
Absolutely.
correct it is, but I've heard that, I guess.
It is very,
So,
very true. I completely second that.
okay, thank you
Yeah.
so much. So, this was last question. So, do you have anything from your side that you want to convey to the audience?
Just that help is there. You just need to ask for it. There are many mental health professionals available. And if you are having a doubt, make sure that you solve those doubts from credible sources, not those who are not experts, not those who are, your family or friends whom you trust. I can understand you trust those best friends and your, gurus, but are they experts in such illnesses, such a field? If they are not, then proceed with caution, because wrong nudge can change your direction towards, worsening of the illness. And take help within time, because if you delay further, improvement also gets delayed, and the course is really bad. So make sure you approach and trust your doctor or your mental health professional. Just that.
Okay. Thank you so much, Doctor. Thank you so much again for joining us. This has been truly insightful, and I really hope that all people also benefit from this. Again, thank you so
Thank you.
much.
Thank you so much for organizing this and allowing me to, talk about it. Thank you.
Thank you so much, Doctor. Have a nice day and take care.